is there one provision among those you guys feel might be especially restrictive or especially damaging to abortion access among those provisions in the bill? Is there one especially that you think, okay, you know, if that one goes into effect, you know, we're really looking at a reduction in access to services?
I would say requiring the clinics to become ASCs. I think the expense involved in that, and there's no real need for it. But you've got the Texas Medical Association, the Texas Hospital Association, and the American College of Obstetricians and Gynecologists saying we are opposed to this legislation. Healthcare providers opposed to it because there's no medical necessity for this. This was very clearly a political decision. It's hurdle. It's just adding another. So this legislation, several other hurdles that have been added in the past. But I think that one followed very closely by the hospital visitation privileges because the doctors aren't going to be able to do those.
Yeah, I mean, I would say the admitting privileges, when you really look at it, are the most damaging. You know, you can have a clinic that meets the ASC standards. As, you know, we do have 6 clinics in the state that meet those standards. But if you don't have any doctors who can practice there, it doesn't matter that you have a clinic that meets those building requirements. So the ASC and the admitting privileges are like the 1-2 punch of limiting access.
Yeah, I don't have anything to add. I would say Amy Hexter-Miller, who's here, who is the president of Women's Health, I've heard her talk about the admitting privileges part of this, which she would do so much better than I would. But the impact it's already having, because it's going to go into effect in October, versus the ASC, which in theory there's more time to prepare for it because it won't go into effect until next year. But the privileging part of it is already having an impact on whole women's health, and I'm sure Planned Parenthood as well. So that, you can talk about the damage right off the bat. Whereas the ASC, you know, they gave them the extra time in order, in theory, to mitigate and the impact of that. So I like the 1-2 punch is certainly a wonderful way to describe it.
The only thing too is that, in fact, Amy told me about her research on the costs of clinics having to elevate themselves to the ASC standards. It's just financially impossible to do, and that's why you're going to see the shattering of so many clinics.
Not to mention that September 1st, 2014 is not enough time to build or retrofit a clinic. I mean, by the time you raise the money, get the architect, hire the builders, you know, we see how long it takes to build a building. You know, it's not going to happen in less than a year. It's just not.
And I think it was, Amy should be up here. I believe it was you who did your own survey about after the state passed saying that after 16 weeks you have to go to an ASC to have an abortion, and for 2 years, correct? 1 or 2 years? 2.5 years.
There were, in 2004, when that first HB 15 passed that required all procedures over 16 weeks to be done in an ambulatory surgical center, it was 2.5 years before anybody was able to build a retrofit, before there was anybody in the whole state who was able to go past.
Could you repeat that?
In 2004, there was a law passed called HB 15, which was when all of the procedures over 16 weeks had to be done in an ambulatory surgical center, which is why there's 5 currently in the state that provide abortion care. It was 2.5 years before anybody in the state could either retrofit or build a facility. So there was no access to abortion over 16 weeks until halfway through 2006. And there's still today only 5. And that's 9 years later.
9 years ago.
So if that's the model for how long it takes to do that, 2.5 years, and we have about a year until the regulations kick in from now. So that can be kind of a sobering indication of how restrictive it can be, you know, in terms of efforts to kind of keep fighting this issue, we know that, yeah, the bill passed. What are some of the things that are being done now to you know, keep fighting the bill or the law at this point, prevent some of these things from fully taking effect, what are some of the things that are being done now to try to mitigate those implications we were talking about?
I know there's a lawsuit that's in the works, and I think you might be able to speak to it better. And then,
Yeah, there's a lawsuit.
Speak up,
It needs to
please.
be filed
Yeah, could you
possibly
speak
this month.
up?
Sure. A lawsuit is in the works, and I'm not privy to the details of that, Amy. But Amy's involved. And then what I do is elections. So registering voters and informing voters, because the only reason these things happen is because of people that were elected to office.
And one of the things that we're seeing are different grassroots efforts springing up in order to fund different aspects of access. So Fund Texas Women, which Lindsay's sitting here in the front row, is going to try to put an effort to raise money to pay for bus tickets to get women to clinics. There's two different, all the doulas, the full spectrum doulas, and here in Austin, and one in Fort Worth, thank you, that are doing their own funding, or it's not necessarily funding, right? It's to help people find places to stay if they need to travel into the cities in order to get abortion. There's someone who set one up in Bryan because their clinic is shut down, and so to get access just to basic reproductive health care in the Bryan area is really difficult now. So that's exciting on some level to see sort of Texas really take, a real responsibility going forward. They're saying we're going to do this on the ground and stuff, and we're seeing it in all different places in different ways, and that is a good example of really concrete activism that's happening, as well as getting people registered for the people who are doing the lawsuit.
Then I'd add, the Bryan College Station example. It's not just that the Planned Parenthood that closed down there did abortions, but they were also the last remaining affordable women's preventative health care provider. Now there is no place for a woman in Bryan College Station to get a pap smear or STI screenings without paying at least $150, which is a lot of money for a college student or for a low-income woman. And so they're not just talking about transporting women to Houston and Austin and other areas to get abortions, but just to get basic preventative health care. That's how bad it's gotten in the state.
And the other thing that's happening sort of now is we're about to enter the public comment period for the Health and Human Services Commission, which they sort of clarify the language of the law for providers so that providers make sure that they're not doing illegal things, right? And so we're not sure exactly when that 30-day period will start, but the public will be able to provide comments to the HHSC, asking them to be compassionate in the way that they interpret the law. And I know that there are people who are organizing to make, once again, just keep reminding the state and legislators that we are here and we're still angry and we're not going away. So that's sort of the next, what the impact will be is, who knows. But I think it'll be fun to see how HHSC responds to all the comments that they're probably going to get.
Yeah, there'll be any response.
Well, I don't know how they're going to manage their email.
Well, let's talk about some of the reaction, because there's been a lot of talk about carrying forth the energy that was generated from the legislative debate over the summer. I personally found it interesting that a lot of the language that was used, especially on the Senate floor from Republican leaders the day that the bill passed, there was a lot of talk about, well, we need to fund family planning services and women's health services even while we're passing this bill, because the narrative and the language that was being used was this was a quote-unquote bill being passed for women's health. where 2 years earlier, the legislature had cut, as you mentioned, funding for family planning services quite severely. We've seen, I believe, more than 60 clinics close at one point. So bring it back. Do you guys read anything into that shift in tone? And do you foresee any carrying forward of the momentum of the energy or a backlash stemming from anger generated from this bill being passed? Does that question make sense? Okay.
Sorry.
Well, let me ask it another way. What do you see in terms of how can the momentum be carried forward? The momentum that was generated this summer, how can that be carried forward into volunteering to mitigate some of the circumstances? You talked about the busing, and into elections in 2014. Do you see that happening, and what are some of the key things that need to be done for that to happen?
Well, I think it's not just momentum. I think Texans got a huge educational piece, both into the legislative process in general and to what's been going on in the legislature that's been going unnoticed for 2 decades now. And so that is invaluable. I mean, I could spend hundreds of thousands of dollars and travel all over the state trying to do the education that we got in 4 weeks. It would take years. So that was phenomenal. And I look around the room and I see all these people who were there day after day, and this is just a small fraction of the people that are still out there, and they're contacting us and they're saying, what can I do now? What's next? You come train us. And so that's a lot of the groups are focusing, and NARAL Texas is focusing on furthering that engagement, continuing the training and education, and getting people plugged into what they can do in their local communities. So, next time we have a legislative session in 2015, we'll have, groups of folks around the state trained, educated, engaged, ready to go to, their district offices, writing the letters, out there in their communities doing the work, and, leading up to that, up to the elections. And that's the goal at this point.
And hopefully in the next legislative session, we'll have some new legislators. And, they just barely made it by the seat of their pants and are very afraid to touch this stuff. So I think a couple things to as I reflect back. I went to the Capitol yesterday. I hadn't been back since all of this craziness, and it was interesting to me. It was very surreal for one. But some things that I've never seen the Capitol so full of people that they had to close the doors because it had surpassed the occupancy level. It never happened. Probably won't happen again. It's incredible. And despite that, the Republican leadership said we're going to go forward without you. They had an illegal vote. They covered up the illegal vote. Then they tried to get everybody to forget about the illegal vote. And it's incredible what the people did. And I don't think that goes away. I mean, I think people might be tired, but I don't think they've forgotten. And then you look at well, the evidence is that, look at Wendy Davis's campaign report. She raises $500,000 in small donations, $100 and less. I mean, that's just never been done. And I don't know. I think I think the people surprised us. I mean, initially at that first day of Farrar's hearing, I called my friend Diane Moser in Houston, who was dealing with some medical issues. So she calls Lizzie Burr, and I said, all I need is 200 women to slow this thing down, to get us within strike of the Senate get filibustered. And I just need 200 women. That would have gotten us past midnight, bought us another time, because that was the end of the weekend, and Tuesday was the end of that first special session. And little did I know that I'm watching my iPad on the dais, and the numbers keep growing, and the people came to testify. So what they did with, I know this is one of your questions, with the social media was incredible. It's never seen. And then I'm looking at Facebook and I see a bat signal up on the building that I'm in, and I have no idea is there. So the people surprised me, and I think the people will continue to surprise everybody.